Every 2 years, the Lymphoma Coalition does a global patient survey on lymphomas and CLL to really understand the patient experience. Health literacy has been something that has been a key priority for the Lymphoma Coalition for a couple of years now. We look at it in different ways. We look at it from a policy lens because we see that there's some proof that governments that institute some benchmarking and then some education for their populations looking at their health actually are seeing some improvements overall in health literacy. And then, of course, we ask some questions through our global patient survey around what patients do and do not understand. And sometimes the way we ask these questions is around, do you understand these terms well enough to have a conversation with your healthcare team about them? Or if the healthcare team brings it up, do you understand that so you can continue and fully participate in the conversation? And so in this case, we were looking at some terms that were more related to CLL. So we looked at, stable disease, treatment holiday, other items like minimal residual disease, for instance. And with all of those, again, it was that, do you understand this well enough to participate in a conversation with your healthcare team? And there's quite a variety in the responses. And so you see things like stable disease or indolent disease. Patients do understand, for the most part, those terms. But other terms like minimal residual disease, about 40% of patients don't. That's quite significant. So if you're not really explaining well or checking in and asking your patients when you're using terminology, do you know what that means? Do you need me to explain that to you, or verifying even if they do think they know that they actually do understand and haven't Googled something or misunderstood something along the way? So those are important pieces just to ensure the patients have the information they need and can fully participate in their care.